Welcome to today's Explainer. We are diving straight into a medical mystery that sounds honestly almost contradictory. Imagine the room violently spinning out of control right in the middle of a migraine. Or maybe even more confusingly, experiencing these intense, debilitating dizzy spells without having any headache at all. We're going to unpack exactly why this happens, and we'll be relying on the absolute latest clinical guidelines to bring some much-needed clarity to a very confusing condition.
So, have you ever found yourself asking this exact question? Why am I so incredibly dizzy, but my head doesn't hurt? Let's just start by validating how unbelievably frustrating that experience is. So many people suffer from moderate to severe dizziness and feel completely dismissed by doctors simply because they don't have that traditional pounding headache. But, as we're going to explore today, this is a highly specific, medically documented reality that affects a massive number of people.
What's really surprising here is just how common this condition actually is. We're talking about vestibular migraine, or VM for short. When you look at the hard data, VM accounts for an astounding 5 to 15% of all patients who walk into dizziness clinics. This isn't just some rare anomaly. It actually has a lifetime prevalence of about 1% in all adults, and it's particularly prevalent among women in their 30s and 40s who actually experience this at a rate 3 times higher than men. To put that into perspective, if 10 people walk into a clinic complaining of dizziness, at least one of them likely has vestibular migraine.
Here is our roadmap for today's explainer. We'll cover the dizziness-headache connection, exactly what vestibular migraine is, the 4 diagnostic criteria, spotting the red flags, triggers and modern treatments, and finally, tracking your symptoms.
All right, part 1, the dizziness-headache connection. Let's understand the overlap of these symptoms.
So, what exactly is vestibular migraine? At its core, it's a condition linking moderate to severe dizziness, or vertigo, to a history of migraines, often occurring entirely without a concurrent headache. The symptoms are incredibly varied. Patients might feel a violent spinning, a rotational vertigo, or just a constant unsettling swaying sensation. And the triggers for these dizzy spells, they are fascinating. They can be provoked just by tilting your head, walking into a busy crowd, or even staring at a really bright screen. It's essentially a massive sensory overload.
Moving into part 2, what is vestibular migraine? Here we're shifting our focus to time and triggers.
To really understand this condition, we have to look at a major paradigm shift that happened in the medical community back in 2021. Doctors today rely way less on the exact feeling of the dizziness and much more on its duration. Evaluating a timeline of the symptoms perfectly isolates vestibular migraine. If your dizzy spell lasts just a few seconds to maybe 1 minute, doctors will often look at a condition called BPPV. If you've been dizzy continuously for over 3 months, they might look at something called PPPD. But vestibular migraine fits a very specific, distinct window. The dizzy spells last anywhere from 5 minutes up to 72 hours. Now, a huge point of confusion is how VM differs from Meniere's disease, mostly because they can look remarkably similar. The absolute crucial differentiator here is hearing loss. In Meniere's disease, patients experience progressive hearing loss that actively worsens with every single attack. But in vestibular migraine, hearing loss is very rare, and if it does happen, it's mild and temporary. To make things just a bit trickier, though, studies show that about 30% of vestibular migraine patients actually exhibit Meniere's-like symptoms. That overlap is exactly why tracking your specific symptoms over time is absolutely essential.
Part 3, the 4 diagnostic criteria. Let's decode the 2021 Barani Society update.
In that 2021 update from the Barney Society and the International Headache Society, they established a very clear checklist. To get a definite VM diagnosis, your doctor actually needs to check off all 4 of these strict boxes. Step 1 is Criterion A, which covers attack features. You must have had at least 5 episodes of dizziness, each lasting between 5 minutes and 72 hours. Plus, that dizziness has to be moderate to severe, meaning it is actively disrupting your daily life. A single mild dizzy spell just won't meet this threshold. Now let's look closer at the next steps, because this is the real secret behind vestibular migraine. Criterion B requires a current or past history of traditional migraines, those one-sided, pulsating, severe headaches. But look really closely at Criterion C. It dictates that during your dizzy spells, at least 50% of those episodes must feature a migraine characteristic. Yes, that could be a headache, but it could also just be sensitivity to light or sound or a visual aura. Because it only requires half of your dizzy spells to have these features, you could easily have multiple debilitating dizzy attacks completely free of any headache and still perfectly meet the criteria for vestibular migraine. If you only meet some of these, doctors might give a probable VM diagnosis instead. Part 4.
spotting the red flags. This is when to seek immediate emergency care.
We absolutely have to take a moment to impartially review these stark red flags because safety comes first. If you experience the sudden onset of severe dizziness, or if you're over 65 and experiencing this for the very first time, you need to seek immediate medical attention. Things like progressive worsening of symptoms, one-sided numbness, slurred speech, double vision, and inability to keep. Part 5, Triggers and Modern Treatments. This is all about taking control of your condition. So what actually causes these attacks? Well, these common vestibular migraine triggers are going to look incredibly familiar if you know anything about traditional migraines. We're looking at things like sleep deprivation, the buildup and sometimes the sudden release of stress, hormonal changes like menstruation, fluctuations in weather or barometric pressure, specific foods like red wine and aged cheese, and high sensory environments like strong lights and dense crowds. Interestingly, these triggers are highly individualized. What sets off one person's VM might not affect the next person at all. Finding your specific pattern is step 1. When it comes to treatment, the medical community uses a multi-tiered approach. For acute attacks, meaning right when the dizziness hits, doctors may prescribe triptans, anti-nausea meds, NSAIDs, or short-term vestibular suppressants. But here is an absolutely crucial warning. Do not overuse vestibular suppressants. Think of them like crutches. Using them every single day can actually hinder your brain's natural ability to recalibrate and balance itself out. Now, if you're having 3 to 4 or more attacks a month, doctors usually move to preventives, like calcium channel blockers, beta blockers, or antiepileptics. And we can't forget non-pharmaceutical tools, like vestibular physical therapy and cognitive behavioral therapy to help manage the heavy anxiety that often tags along with this condition.
For those dealing with severe refractory cases that just won't quit, there's an incredible modern breakthrough: CGRP monoclonal antibodies. Medications like Emgality, Ajovy, and Aimovig are showing highly promising relief, and not just for the headaches, but for the dizziness symptoms too. However, there is a major factor to consider here, which is the cost. Roughly 30,000 to 40,000 Japanese yen is the typical monthly out-of-pocket cost for these cutting-edge preventative injections in Japan. They are an incredibly powerful tool, for sure, but they require a specific diagnosis of chronic migraines or frequent attacks, and they definitely come with a financial commitment.
Finally, Part 6, Tracking Your Symptoms. Let's talk about the sheer power of a headache diary. The power of keeping a headache diary literally cannot be overstated. Whether you're a pen and paper person or you love a good smartphone app, you need to track these specific data points for just 2 months. Write down the date and time, how intense the dizziness was, any accompanying symptoms like light sensitivity, exactly what medications you took, what you ate or experienced right before the attack, and how it impacted your day. Doing this transforms vague, confusing feelings into hard, actionable data. It will dramatically speed up your doctor's ability to diagnose and treat you effectively. Which brings us to our final, empowering question. What will your diary reveal? By understanding the strict diagnostic criteria, respecting the red flags, and tracking your unique data points, mastering vestibular migraine goes from being this frustrating, scary mystery to an entirely achievable reality. You have the tools to uncover your specific triggers. So grab a notebook or download an app and start tracking today. Thank you so much for joining me for this explainer, and keep learning.